Hi guys, my name is Annabella Vidal Ruiz. My presentation is on assisted animal therapy. And here I have a picture of me and my little puppy Inca, which sparked all of this, all of this research. And so I thought it would be great to include her into the presentation. So my PICO question is, in elderly patients in nursing homes that are ages 16 and above, does animal therapy compared to no animal therapy reduce depressive and cognitive symptoms? And so I really wanted to set a very clear population for this. So I wanted it to be elderly patients 60 and above that did not have a fear of animals. The intervention would be assisted animal therapy as a means to improve or prevent the development of depression, anxiety, and cognitive symptoms. And the comparison is to patients that do not receive the animal-assisted therapy. And the outcome would be depression and cognitive symptoms, which will change as we go through the research. So the reason I chose this particular subject was from my personal experience. My grandmother was suffering from Parkinson's and Alzheimer's for about 15 years. And just seeing her progress through these diseases, it was hard. But she lived with my aunt who had she has like 5 little dogs, and seeing her interact with these dogs, I could see how much joy they brought her. And so that was really what started all of it. And then also I work on a medical surgical floor, and we get a lot of older patients. A lot of these patients are complete care or nonverbal. And so that really sparked my interest in learning more about elderly patients in general and this whole process of end-of-life care. Inca is my small child, is my little puppy who I got about a year ago, who's about to turn a year old. And so we're having a little birthday party for her. But just seeing how much my life has changed from before I had her to now, a year later, studies have shown that having an animal or a pet can increase good health, can decrease loneliness, and even makes you more active. And so I've noticed such a big difference in my life. I thought it would be interesting to see how animal therapy works out in the professional world. And then also I was reading this really interesting book that if any of you have time, which who of us does, by Atul Gawande, who is actually a very famous author. He's a New York best-selling author and also a famous surgeon. Wrote a book called Being Mortal, Medicine and What Matters in the End. And the book covered a lot of how medicine isn't really equipped to deal with the end of life or help people go through the end of life, that we kind of try to always do these life-saving measures when really we should be guiding people through this process. But he looks at different aspects at the end of life care. But one aspect he was looking at was nursing homes. And in nursing homes, he mentioned several projects where they had brought animals in. And I just wanted to read a quote from his book, where this was a facility that had brought in birds and had brought in dogs and some cats and stuff. And so this is the man who had started all of this. These were his quotes and what he noticed. And he said, people who we had believed weren't able to speak started speaking. People who had been completely withdrawn and non-ambulatory started coming to the nurse's station and saying, "I'll take the dog for a walk." And so it was just really showing how animals had really given a little bit more life to these nursing home residents. So that was the reason why I chose this topic. And literature review. So I looked at 4 articles in depth. And so one of the articles, which is developing effective animal-assisted intervention programs involving visiting dogs for institutionalized geriatric patients. And a lot of these are pilot studies because this is it's an emerging field. They didn't see any differences between the control and experimental groups on the geriatric depression scale. So the geriatric depression scale is a measure that was used through various of the studies that I had looked at, and it's a measure that is very valid, that is very statistically significant. And so they did notice visible changes in apathetic state. In the next article, an investigation of the effects of dog visits on depression, mood, and social interaction in elderly individuals and living in a nursing home. The dog visits did not improve depression scores, mood, or social interactions, but the residents reported that they enjoyed the visits, that they found joy just having visits from the dogs. These other two articles had higher sample sizes, and so I thought that their results were more interesting. And so in this one, the effect of a companion dog on depression and anxiety levels of elderly residents in a long-term care facility. So most of these studies use pre-test and post-test models. So the pre-test show that there are no significant differences between the control and experimental groups for depression and anxiety, which is perfect. That's exactly what you want to see, that there are no differences between prior to the intervention between the control and experimental groups. The post-test scores were interesting, and this is where we do want to see a change. So they did see significant differences between the groups for depression symptoms. There were no significant differences for anxiety symptoms. In those differences, we wanted to see exactly what was happening, and they actually found a decrease in depression with the experimental group. In the next study, pet therapy in elderly patients with mental illness, again, bigger sample size with this study, they used the geriatric depression scale, a measure that I mentioned before, that's a very valid and widely used measure. And they used a mini mental state exam. And so they did a pre-test, post-test model, and the post-test did show significant differences between groups in depression scores, and the experimental group showed a decrease in depression, but there were no significant decreases with the mini mental state exam. So we are seeing, the results are kind of mixed, but we are seeing that depression, that animal-assisted therapy can have an impact on depression in elderly residents. And as we know, people with depression tend to have higher chronic illnesses, tend to have more somatic complaints. And so being able to handle this depression would be such a benefit for these residents. So the guideline that I came up with is we always want to determine eligibility criteria for participants. I wanted to focus on one animal, and since most of the studies focused on dogs, I wanted to focus on dogs. Plus, I have Inca, so there was that too. So eligibility criteria, we wanted to make sure that these participants did not have an allergy to dogs, were not fearful of dogs, did not have a disorder impacting their ability to interact with dogs. So if we have a patient that is completely nonverbal, that is completely just like not cognitively there, that might impact their interaction with dogs. I'm not saying that this will constantly be the eligibility criteria, as I read in the book that these what the director of this nursing home had said, that people who had believed weren't able to speak started speaking, that there is a place to expand this program to include those people. But I think right now for the pilot study, which is what we're trying to do since this is an emerging field, that it would be better to kind of have them not part of the study at first. And then 65 and older is another eligibility criteria. And so we want to establish a sample size. Again, this is an intervention that is, it's non-conventional. It's something that that seems like it could work, but it's not something that's been widely studied, like other interventions might have been. And so establishing a sample size is important. What nursing homes do we want to do this in? Do we want to include all the residents that we possibly can, or do we want to start with a smaller group, and then when we see success or we're able to make changes, get constructive criticism from that group, expand the program? So I think that that's a very important part of this. Again, we want to find statistically valid measures. So because most of the studies were kind of had mixed results, and anxiety and cognitive symptoms didn't seem like it was very, there were no results that showed a decrease in those. I thought we would focus on depression. And the geriatric depression scale, as used in various of these studies, seemed to be very key to all of this. It's something that has been used over the years, something that's been used throughout this population constantly. And so I think keeping this statistically valid measure was important. Also, we want to determine eligibility of dog training. Putting a puppy in this environment, probably not the best idea. What do we want these dogs to be able to do? If there's an emergency with a resident where there needs to be a rapid response, we need these dogs to be able to sit in a corner and not confuse care. We need to make sure that these dogs don't bite or nip. Even nipping, elderly patients have very thin skin that easily breaks. We need to make sure that these dogs aren't like jumping all over the patients where there might be a possibility for a fall or for possibly breaking a bone. Like, these patients are very delicate. And so those are certain things that we need to think about. What exactly do we want to require of these dogs before they can enter this environment? Also, we want to determine the setting and establish a protocol implementing the intervention. So in various of these studies, some of them would have personal visits one-on-one with the dog. Others would have visits in group settings where they would have the visit in a common room. And so since our goal is to decrease depression, which indirectly means increasing social interaction, I thought that visits in a group setting in a common area would be best. Again, we want to establish that we're going to be using, what do we want to do with the dogs? Do we want them to just be near the dogs where they can pet the dogs? Are they going to be able to give treats to the dogs? Can they teach the dogs tricks? Can the trainers help teach the dogs tricks? Are they going to be able to go on walks with the dogs? So these are things that we need to establish prior to implementing the intervention. And then, again, like we said, with the interaction with the dogs, how exactly do we want them to interact with the dogs? Will they be responsible for the dogs? Will the dogs live in the facility, or will they just come and visit? And then measures should be administered baseline and post-intervention to track progress of depressive symptoms. And so what I recommended was to do baseline and then administer the measures after each visit, and then a 6-week follow-up. But it also just depends on how long you want the intervention to go on for. So implementation, so plan, 4 to 6 weeks. Eligibility criteria that we discussed before. Who do we want involved in this intervention? We need to determine what measures are we going to use. The geriatric depression scale, to me, seems like the perfect measure, but maybe there are other measures that are widely used within that facility that might be more statistically valid for them. Determine which animal and what training criteria the animal will need to abide to. Again, we're putting an animal in a very hospitalized setting, very institutionalized setting. So we want to make sure that these animals are calm under pressure and can really respond to the trainer when needed to. We also need to train staff and animal trainers to implement these interactions with the animals appropriately. This is especially important for staff, just to make sure that the interaction between the animal and the resident will be successful. So, for example, maybe the staff will refrain from vacuuming or something that might really stress out the animal, so that interaction will be successful. Also determine what each participant will be able to do with the dog. Will they be able to play with the dog, throw the ball around? Will they be able to give treats to the dog? And will they be able to walk with the dog? These are all things that interacting with this animal that can decrease depression for these residents. And then I think starting with a pilot program with maybe 20 participants and seeing how that goes, being able to slowly implement suggestions from staff and participants before expanding, I think is important. So finally, the part to implement this, 6 to 8 weeks. So we want to start by assessing baseline using the GDS. We want to make sure that we want to have a baseline for all of our residents that will be involved in the program. We want to create a control and intervention group, and this is just to track effectiveness and future development of the program. And so we want to be able to say, okay, these are the participants that will have the interaction with with the animals, and these are the participants that won't. And is there really going to be a change here? If there's a change, maybe expanding the program isn't a bad idea. This also gives us time to make changes in the program for complications that aren't foreseen. Then we start the weekly visits in a group setting with the dog for 30-minute periods. I don't want to expose the residents to the dogs for a long time or have the dogs live with them immediately. That might be a little overwhelming. So I think doing the weekly visits in a group setting where they're not only get to interact with the dog, but they also get to interact with other residents, and for 30-minute periods, so it's not too long where the residents could tire out. And then allow time for socialization among the animals and the participants. This is really important. This is the part where we're gonna see perhaps this increased socialization, less isolative behavior, or maybe people are more motivated to go to this intervention because they're gonna see their friend or they're gonna see the animal that they're fond of. And so this is a part that's really important. We need to really allow time for this. And then to administer the GDS after each interaction to the control intervention group. I think this is important because although it's great to see pre-test prior to intervention and then 6 weeks later post-test, it'll be interesting to see the changes over time. Maybe this will also prevent, like, let's say there's a really bad interaction right at the end of the intervention and then we give the post-test. That won't be a true indication of how the intervention worked throughout over time. So really having these little check-ins will help us see, give us a bigger and more clearer picture of how the intervention is going. Study. So we need to ask staff for suggestions to improve the program. Staff are going to be the people that notice the differences within the residents. They're going to notice complications perhaps with the dogs and bringing them in. They're going to notice different little things because they work with these residents every day. They work in this facility every day. So really asking them for suggestions is very important. Evaluate GDS scores after each interaction at the conclusion of the pilot study. We discussed this earlier. It's very important to do this so that we can get a very clear picture of how the intervention works on a whole. Hold a focus group with participants to evaluate the negative and positive aspects of the intervention. Again, the participants are the ones that are experiencing the changes. The participants are the ones that are involved in the program. They're going to have the most invaluable suggestions, and so we really need to ask them in order to make small, even if it's small or bigger changes, to understand, like, how will this work? How can we make this work better in the future? And compile a report to determine the viability and impact of the intervention and determine if a larger study should be started. And so that report is going to be essential. Is this intervention something that we want to continue in the facility? Would this have a good impact on our residents? How will this change how our facility works? Should a larger study be started? All very important information. Act. So this is going to be ongoing. Again, like we said, we're going to be identifying areas of improvement through staff suggestions, participant suggestions, observations. We're going to be implementing these suggestions. We can ask the staff and participants for ideas on how they think we should implement these suggestions. And again, ask for feedback from staff and participants. How did the intervention go? Did you notice any changes? It's all very important information. Evaluation. So we are using the pre-test and the post-test model. This is a very good way to see if there are any differences between groups, to see if the intervention is actually decreasing depression. The measure we're going to use, geriatric depression scale. Again, various of the studies that we used for the literature review use this scale. The scale is widely used throughout the geriatric population. So timeline, since we're doing the pre-test, post-test, we're going to establish a baseline. We're doing weekly follow-ups, and then we're doing a 6-week follow-up, just to see how the program is going. And then we want continuous reassessment. Staff and participant recommendations are essential for this. We want to continually tweak the program to make it more successful. And our objectives will be a decrease in depressive symptoms. The GDS scores are going to tell us that. And then also staff observations are very important. The staff spend days with these patients. They're there every day. They see how these patients normally behave. They're going to be the ones that are going to really tell us if there are significant changes in these participants' behaviors. We also want to see a decrease in signs of depression. There are various signs of depression, which are common in nursing homes. A loss of appetite. We commonly see that as failure to thrive in the hospitals. A decrease in motivation, loss of energy, low self-esteem, isolated behavior, under or oversleeping, all things that are signs of depression. And so we really want to be on the lookout for those signs. Is there a decrease? Are more participants participating in shared meals? Are more participants slowly being involved in these in groups? Things like that. And it's because of this that staff observations are essential, and we discussed that earlier. So in conclusion, and this is a lovely picture of Inca in her birthday costume since she was born on Cinco de Mayo. Animal-assisted therapy can have positive benefits on elderly residents. We can see that decrease in depression. And honestly, this is an intervention worth pursuing because there are no, you bring an animal into a nursing home, you try it out. What are the negative effects that could possibly happen? If anything, it's very easy to take the animal out of that environment if need be. But the positive benefits really outweigh those risks. This is an intervention really worth pursuing. Animals, I've noticed such a change in my life with my dog. I've known friends that have their lives have changed because of their dogs. And really, they bring us so much joy. And so this is an intervention worth pursuing and at least just seeing if it's something that can work for that facility. This may not be something that works for every facility, but it could work for some facilities, and that is worth investigating. Implementation can have great positive benefits. It could decrease the isolative behaviors. You can see your patients are eating better. They're sustaining their life better. And even these nonverbal patients, maybe they'll start talking. Maybe you'll see a smile. And those are all things that are really great to see. And then this program would need to be evaluated to further research. I think every program or every nursing home that decides to try animal-assisted therapy should at least create reports to further this research within this field. It's very important to find interventions that will really decrease depression among residents, since depression can contribute to chronic illnesses and somatic complaints. And then I have my references, and thank you so much for listening to the presentation. I really appreciate it, and I hope, I don't know, maybe this inspires a few of you to get a puppy. All right, have a great day, everyone.